In 2009, Illinois began a major shift to managed care for Medicaid enrollees. People with disabilities were the first to be enrolled. A group of advocates from Access Living, Health and Medicine Policy Research Group, and Sinai Health Systems came together to ask if we could design a system, what would it look like?
Are there models around the country that really seem to understand how to do this well for people with disabilities? There aren't very many. Most of managed care has not worked particularly well with people with the most complex conditions.
Based on the pioneering work of Dr. Robert Master in Massachusetts, the Community Care Alliance of Illinois was born to transform managed care in Illinois. CCAI put the patient in control, supported by a team delivering medical, mental health, and social services.
Well, it was very important to me to be part of a team that was truly patient-centered, that really wanted to do what's best for the person, and that really wanted to have the person be their partners in healthcare, not just somebody they dictate healthcare to.
CCAI developed a system of anchor health homes to bring all the services together in one place.
Having actual anchor health homes that are near the patient's location and that can serve them the best way, that are fully accessible, that somebody can get on an examination table on their own. It's very important to have our staff, our care coordination staff, that is going to actually interact with the enrollee, not just call them over the phone.
CCAI care coordinators pull everything together to serve the enrollee.
And we wanted to build a team that would wrap their arms around our enrollee and really prioritize them, prioritize their priorities, and really link them with what they need to be healthy. Because we know that health is not just about the lack of illness.
I think that a big thing with CCAI for me is the way that we are able to more personalize the healthcare, to be more one-on-one with the individuals. Being able to go into an enrollee's home and assessing a situation and being able to connect them with services that they might not even be aware of that they qualify for is really, really big, I think.
Yeah. I think it's huge, and I think what you just said there, we really should pause and think about where we are in the healthcare system because it's fragmented. Mm-hmm. People don't know how to get things done because there's so many different systems that they have to integrate with.
Just the minor little changes that we made for this family, there were minor changes to the home, but it was like a huge difference in their life.
Minor. Those are major changes.
We want to make sure that people stay in the community. We know that people do not like to be institutionalized. It's not good for them.
It's the fact that I'm able to empower the enrollees, especially those with disabilities, because a lot of our enrollees feel like they don't have a say-so in their care. And to me, they are the experts of their body. Yes. We can also get them access to the medical experts to help them get access to the equipment that they need to get properly fitted for a wheelchair, to get the physical therapy that they may need.
There is a lot of mistrust. There's a lot of negative on the part of the patient enrollees as well. And I always reiterate, I'm like, I'm here for you. I'm your RN care coordinator. If you have questions, I'm here. And it just feels like there's like a weight lifted. You can hear it over the phone. Yes. Even.
I think these conversations are non-traditional conversations in healthcare, and it's extremely important if we want to improve their health that we have them.
And it's just about us just taking the time to listen and sit with the enrollee, and if they need help, we're able to say, okay, I'll help you make that phone call.
We really do hope to set the bar for what managed care can be. I love telling the story anyway. Because it reminds me of how far we've come, right?